Spectrum Health and Helen DeVos Children's Hospital are taking action to educate West Michigan schools about sudden cardiac arrest. This after the death of Fenville basketball star Wes Leonard. They're inviting high school coaches and school administrators to attend an event to teach them about sudden cardiac arrest, how to respond in an emergency, how to give CPR, and how to use an AED.
So Dr. Gauri is an electrophysiologist with the Spectrum Health Frederik Meijer Heart and Vascular Institute. He's one of the doctors leading the symposium, and we thank you, Doctor, for coming in tonight. It was the Wes Leonard event that precipitated this symposium. What is the message that you hope to impart for those attending? Yeah, well, it's really a two-part message. One, there's appropriate screening necessary for athletes prior to participating in sports, which consists of a detailed history and physical. And the second part is having a public access to defibrillation program, so where there's immediate response to patients who have sudden cardiac arrest with basic CPR and access to a defibrillator. You were touching earlier off camera, there's a bit of a controversy about the screening process and what you should be looking for and how sometimes the information that you guys get isn't definitive. Right, right. That's a great point you bring up. If there was a black and white test to screen a student athlete to see if they had cardiac disease or did not have cardiac disease, it'd be easy. The problem is there's a very large gray area. So mass screening has actually been shown in a recent publication in the Journal of American College of Cardiology to not reduce the incidence of sudden cardiac death in student athletes or in athletes. So the message that both Spectrum Health and the American College of Cardiology and American Heart Association are delivering is a proper physical and history by the doctor, and if that tips off any high-risk features, then additional testing such as an EKG or echocardiography is important. Doctor, we know CPR has been in place in schools for decades. The AEDs are a relatively new device. Not all the schools have them. A, do you recommend that all schools have this kind of device on scene? And B, you've got to know how to use them. Right, absolutely. So just having an AED there doesn't really help. You have to know how to use it. So we really have a fairly lofty goal of having every school, every sporting team having a public access to defibrillation program, which means they know how to do CPR, they know where the AED is, they know how to use it, how to get 911 and the EMS people there emergently. And so that's really the message. Yeah, it's a worthwhile program, even if it saves one life, obviously. Absolutely, absolutely. Dr. Gauri with the Frederik Meijer Heart Center. Yes. Thank you for your time tonight. We want to let you know that the Wes Leonard Sudden Cardiac Arrest Symposium, that's Monday at 5:30 at Calvin College. Schools, this is for schools primarily right now, can pre-register to attend by calling the number on your screen there. Again, the event's not open to the public, and we've got this link on our website at woodtv.com, and we'll be right back.